how was the diploma? I know there is like theoretical part first that you have to do, pass, and then the practical part. So
yeah,
how was that? Tell us a little bit about that.
So I know there were changes in the past year.
Mm-hmm.
We have so in my clinic, in the clinic I work for, we have me and the owner as diplomats, and we have 2 diplomats to be. They just finished their theoretical part of it. Mm-hmm. So I know the process had some changes. So I'll tell how was my experience in 2016 when I started. Mm-hmm. So in 2016 when I started, we had this theoretical part, which was a university semester, where it's divided by subject. So you have McKenzie approach, reliability, different classification systems, how to assess a paper, right? This is discussed in depth too. Discussing about treatment for tendinopathy. So it's a variety of subjects that involves musculoskeletal care, and that it's discussed evidence-based. It's very, very literate. So there's a lot of reading, lots of writing, lots of assessing, and it's you and a lot of other people, right? So you don't want to just come with excuse my language, but a crappy paper and show something that, internal validity, it's just out of the bounds, no working. So you really make sure that you do your due diligence and do the proper analysis and assessment of the paper. And then it's all high graded paper. So it's high level discussions. It's a very, very interesting thing. I really enjoy doing the theoretical part of that. And it was done at Dundee University in Scotland, where is a site as well for the diploma program. I think we have 3 sites that allows foreigners to come. You have others, you have in Australia, but it's only for Australians, New Zealand only for New Zealand, I think South Africa only for South Africans. But you have Scotland, which is open for anyone. You have Austin, which is open for anyone. And you have recently in the past year, Montreal also, which is open to anyone too. Done by my great friend Michael Dyke and Duke. They're great guys, really, really good. Mike was actually from the same cohort from the diploma program I am, and it's a great, great guy. So, and Montreal is a great, fantastic city. So for those that are planning to, maybe you, Mariana, planning to do.
I've been thinking.
Montreal is a great option. I mean, I loved Austin. Austin is a great city. You have very experienced mentors there, right? I was mentored by Chris Chase and Kim Green. They're excellent. The city is amazing. But Montreal is very special. But again, I'm biased, right? I'm sort of a Montrealer now after 10 years. So for me, it's a little biased opinion. But back to the diploma program. So you have that theoretical program, which is lots of discussions, lots of reading. And then you have to write 2 essays. You write the essay. If you pass, if you get a good grade, you move on to the practical component. The practical component, there's usually a waiting list as well, depending on the site you choose. Austin, there's usually a waiting list. But once that waiting list is gone, you go to the diploma program, the practical component. You do the practical component, and it's both of them. I mean, there's no stress-free part of it. And I mind you, they advise you to work part-time throughout the process. I was a full-time clinician all through the process.
Oh,
so,
wow.
Yes, and I had a small kid. It was tough as nail to accomplish that. I looking back now, I was like, how did I do it? But, well, hard work pays off. That's what they say, right?
Yeah,
so,
yeah.
And indeed it did. So I went to this diploma program. The diploma program, it's you have to be open-minded, right? Regardless of your level of experience. And ego sometimes can get in the middle of things, right? Because you're doing that for a while, and then sometimes you get some critics that they're always constructive, but sometimes you get a little, touched on your ego, saying, "Oh, I've done that forever. What are you saying?" Right? But anyways, you have to be open. You have to. So I went there engaged in being an open mind, open spirit for that. But the first time you're there with the patient, and then your mentor is there when it's bored and writing stuff, and you're like, crap. The first mistake was my first patient. we were in the, because you pick up from maybe a clinician that was there prior to you, right? And I got someone that was starting recovery of function. Recovery of function was something that I was not very used to do before the diploma program, because my patients, pain was gone, bang, they were gone. And I kind of didn't mind that back before I did the diploma program. Now I know it's a stupid thing I could ever done. But they said, okay, let's start recovery of function. The first thing I did was flexion and standing. Oh man, just kick it in. Said, no. Okay, so lie down, let's start. And I was like, red, flushed, right? And I was like, oh, how can it be? And I had this roommate, my partner in crime there in Austin was 𝐓𝐿𝐴. 𝐓𝐿𝐴, he's a mastermind of MDT. The guy knows everything. The guy is so I was like, oh, and he was in the room with me. I was like, oh, come on there, you know. And I had this little sort of pressure on me because I got a beautiful letter of recommendation from Colin Davis, who's my biggest mentor in the MDT. So you know how Colin's experience and everybody looks up to him. I didn't want to make him look bad, right? So the first thing I do that stuff. But you know, I shook it off and I took that as a learning experience. I was there for that, right? Yeah. And then Kim came out, oh no, Eduardo, it's fine, you know, because she saw I was a little upset. And she came, no, it's fine, you know. And I was like, but you know what, Kim? I didn't come here for taps on the shoulder. I came here for kicks on the nuts. So that's how it is, and that's how I'm gonna build up myself. There's one sentence, Mariana, that I truly believe, that I carry wholeheartedly with me. It's the literate of the 21st century is not the one that cannot read or write. It's the one that cannot learn, unlearn, and relearn. I was through that process. I had learned, but it was time to unlearn some of my concepts and relearn. And if I couldn't open my spirit to that experience, I wouldn't have succeeded in the diploma program, which is very demanding, very demanding. So you have to find a valve of escape. Mine was running. I ran almost every day there. I ran what they call the turkey trot. I was there during Thanksgiving, and they have the turkey trot. It's an 8 kilometers run I did. It was fun as hell. So my experience on the diploma program was A+, and I would recommend to every clinician, everyone, even the ones that are most experienced, and they think there's nothing to be learned on the system anymore, go do the diploma program, because there's tons to learn. And you can only learn if you're inserted in that kind of environment. I was working elbow to elbow with the diplomat too, and I still learned. So it's the whole environment that inspire MDT, that you need to be inserted that for the whole 9 weeks to get the experience. So I recommend to everyone. If I had the money, I would do it again. Let's put that like that.
You're always learning, right? Like in the courses, when you start repeating, you always learn new things every time you see something. And I imagine that times 100, probably on diploma, that on that experience, emerge there and just breathing there, living there.
And that's an interesting thing, though, because I don't know if you know, but even the states you can do that too. Certified, they can give lab assistance to courses. So you can write the McKenzie Institute. Let's say they have a group of 25, 30, which is not in the States. It happens all the time. You can write the McKenzie Institute and say, listen, are you guys in need of assistance? Can I assist the course? And you can redo the courses as an assistant. So before I had the guts or the money or the guts to spend that money on the diploma program, that's what I was doing. I'll tell you, I probably had done maybe 5 times part A, 6 times B, and so on and so forth, doing that assistance. I was always assisting courses for Colin here, and I did assist in the States too when I was there. So I'm pretty sure, I know it doesn't happen like that in Brazil, but I'm pretty sure in the States it's no different than in here.
Nice. That's
so, you know, that experience of, it's not really what it's in the manuals that you can read every day. It's seeing the interaction of the instructor with the patients, different patients, assessing, treating. So you can learn quite a chunk of things by assisting those courses.
My favorite part is watching them treating the patients. That's amazing. That's cool. So I think, yeah, you're always learning. I think you should be always open to that. And I imagine how many new things, and like just to do everything step by step, as you said, like sometimes you skip steps, or you're used to do the way that you kind of decide that you're gonna do. It may not be the right way to do, and you start doing that, and then for you that's your truth. And sometimes it's not the truth. Yeah.
It's your truth, right?
Yeah, our truth.
The clear one.
Yeah.
And after you finish that practical component, after 6 months, you have to do the exam. And that's where things really catch up. It's really, really hard. It's really stressful. It's 2 days, and you have 3 clinical scenarios every day. It's a tough one. In each clinical scenario, you have 2 like big names of the method. So I had, we did not have Helen, because Helen was handling other business that time. But I had Kathy, for instance, which known to be tough one on the exam. I had Richard Rosedale on my last exam, he was tough on me too, asking one question after the other. You know, that hard patient that has beliefs and questions about those beliefs. That was Richard on my exam, and I was like doing that. I was like, "Why are you doing that to me, Richard? We're both Canadian. Don't do that." and it was pressuring. So Colin didn't assess me for obvious reasons. That's a conflict of interest, right? I'm calling him up and down every time, so it wouldn't be fair. So he did not assess me. But I forgot. It's terrible. I forgot her name, but the instructor from Italy. She's a super nice one, but very experienced. So I had all the very experienced people from the method assessing me during the exam, and it was tough, very, very tough.
Yeah, so you better learn.
Yeah, you better do it, and you better do just once, because if you fail, you have to go back and do it again, and it's not easier the second time, right? So I know people had done twice the practical component and then 3 times the exam, not because they're not good enough, it's because it's tough, and you end up losing to yourself, because it's a nerve-wracking experience. I did sports competition a lot in my life, so I guess that when you do competition before that, I was super stressed. I slept 3 hours the night before my first exam, was super stressed, but when the situation comes, you know how to deal with that easier than someone who's dealing with that competitive kind of thing firsthand. So it was nerve-wracking, but I guess I did well.